Right, so the next one is an education pathway. So in this component, on page 28 in your frameworks, is really just a recommendation to encourage assistants to work to whatever level is required of their position. So it's not a very long pathway, but there's a Certificate 3, and sometimes people say, how does a Certificate 3 work? And I think it's really valid for us to get an understanding of how that works, and so that's why that's included here. And do people have to do the Certificate 3 before the 4? There's lots of questions around that, but there are positions that are relevant for Certificate 3. So it really depends what the position needs as to what level of qualification. So it's just to encourage our assistants to work through whichever education pathway is most relevant there. And clinical supervision. Again, this fits in very well, as Robin said, with the HEDI program. Recommendation is that allied health assistant positions are clinically supervised by an allied health professional, that they have a designated supervisor position. The challenge with assistants at times is that there might be one assistant and multiple therapists, and it's tricky if they're getting pulled in 5 different directions at once and they've actually only got 8 hours in a day. It's helpful to have one person who's designated to make those final decisions. And we might say, well, why can't they just tell them? Sometimes within the dynamics of a team that can be quite challenging for an assistant, so it's quite helpful to have that designated position to keep track of those things and to have that formal supervision that is the recommendation for allied health within New South Wales. We're actually quite good at supervising students and sometimes undergraduate, but we're there's space for us to improve in allied health in general. And then formal supervision sessions being documented. The reason for that is really around the legal aspect, that our assistants are being adequately supervised, and that's an important thing. So that's where anything documented means if you don't write it down, it didn't exist. So that's why that sits there as well. Any questions on supervision? Okie doke. So next one. So along with scope of practice, delegation is probably the next biggest sort of question people would have asked me over the years. Sort of getting that sorted and how that works and what are these in practice. The framework and these guidelines give good directions around that, but again, it's something that needs to be implemented at an LHD level around what's going on and the structures that exist. So it might look different in different LHDs, but as far as how it plays out, but the general principles is what's coming from the framework here. So it's important for the allied health professionals to know what can be delegated, and that's probably one of the biggest questions. What can I ask an assistant to do? That's probably the biggest question that's come to me over the years. It's important for both allied health assistants and allied health professionals to have an understanding of allocated tasks. I don't know if you've come across that concept. A delegated task is something that a therapist might ask an assistant to do, usually around clinical or client contact, but not always. And so the responsibility of that task links back to the therapist. But there might be allocated tasks, which might be tasks that are in the assistant's position description that are their responsibility and theirs alone. They don't actually get delegated. So it might be things like maintaining the stock levels in the splinting room. So they don't actually have to be specifically asked to do that and work through that whole delegated process. It's just part of their job and it's their responsibility. So it's good to get your head around that. It's taken me a little while to work that out, to be honest. And in different settings. There's more allocated tasks in mental health, for instance, than it's not an area I've worked in clinically, but there's more allocated tasks within that because of the structure of mental health. And it's just important for everyone to know who's delegating and who's responsible, who's accountable. All those sorts of questions are the ones that's really important, that everyone knows what their job is and what their job isn't, what they're responsible for and what they're accountable for. Again, it needs to be documented, same reason as for supervision.